Hello, my name is Ford Graves, and this is my advocacy for minority populations of the opioid epidemic. I first want to start with a brief history of the opioid epidemic. According to the CDC, from 1999 to 2019, over 500,000 people died from an overdose of an opioid, either prescribed legally or acquired from illegal drugs or was present in illegal drugs. The CDC characterizes the effects of the opioid epidemic in three separate waves. The first wave began from overprescription of opioids in doctors' offices and hospitals to help decrease pain, as it was relatively new to the field, and people were initially showing signs of help through prescriptions. That happened in the late 90s. The second wave began in 2010 with rapid increases in overdoses from heroin rather than prescription opioids. And the third wave in 2013, where significant overdoses were held from synthetic opioids such as fentanyl, which are extremely deadly in small amounts, and it's really run through the opioid issue. Many opioid-involved overdose deaths also include other drugs. How does race and sex affect those within the opioid crisis? Statistically, Black and Hispanic men are disproportionately affected through the opioid epidemic. Most opioid overdose deaths among adults since 2013 were most concentrated among Hispanics and Black men. Deaths among Hispanic and Black men were disproportionately represented in the overall increase in the rate of opioid overdose among older adults, being 40% rather than 21% for the rest of the population. What does this mean? The opioid epidemic disproportionately affects lower income and minority populations. It rages through these communities and works to prevent them from working, supporting a family, and moving forward socially and economically through the community. I believe this shows biases not only in the healthcare system, but in the legal system as well. How does it show biases in the legal system? Well, those who abuse these drugs and are affected by them are the least likely to have the means to seek help to limit their addiction and find means towards recovery, them being lower income and potentially uneducated people. It is known that people in these socioeconomic groups are disproportionately arrested, policed, convicted than those in other populations. This stems from the higher patrolling and arresting from these populations in the 90s from drugs like crack cocaine. According to SAMHSA, this leads to people being released from jail or prison, having issues once they're released. An individual who doesn't receive treatment for the opioid use once they're in jail return to their hometown once they get out, and they still have an opioid addiction, and so they seek out drugs, and then they take the same doses that they were used to before they were in jail, and that their tolerance is gone, so they have a higher chance of overdosing. Ethically, how can we allow for the disproportionate number of minorities and minority communities that are affected by this epidemic? How can we support and help these communities that are being destroyed and hurt by these harmful drugs? This epidemic in these communities is enhanced by systematic racism and inherent disregard by police forces working to eliminate the issue rather than solve it through help. Has the opioid epidemic slowed down recently? No, the opioid epidemic has increased in its scope and destructive tendencies since its arrival in the early 90s. It continues to tear down and prevent these communities from moving forward. What is being done to help slow the opioid epidemic? The CDC is currently using several methods. They monitor trends to better understand. They advance research and improve their data quality. They're working to build state local and other buildings and systems to help care for and treat these people. They support providers, healthcare systems, and payers with data, tools, and guidance for evidence-based decisions making, and they partner with public safety officials and community organizations, including law enforcement, to address the growing opioid problem. Increasing public awareness about prescription opioid misuses and overdoses to make safe choices about opioids is very important within the community, within the CDC. Thank you.